Hi, today my topic is education in postural and behavioral modification in GERD. GERD is a digestive disorder that affects the constriction of the lower esophageal sphincter, or the LES. Anyone can have GERD, but there's a high incidence of GERD in people who are obese and women who are pregnant. GERD is acid reflux, better known as acid reflux, and most patients say that it feels as if there is a burning sensation in their chest and in their throat, and they may have chest pains. And also they have the taste of acidic or the materials they previously ate in their mouth. The typical function of the LES works like this. So when you eat food, and you swallow it, it travels down your esophagus and goes into your stomach. The lower esophageal sphincter contracts and relaxes to allow food to go through without coming back up. When the esophageal sphincter constricts, it keeps food down into your stomach. However, those people that have GERD, their LES may actually relax too soon, or it relaxes at inappropriate times throughout the night or throughout the day, causing the food that is being digested to come back up through the esophagus and into the patient's mouth. This can be very uncomfortable for patients and can cause other issues of the esophagus. Some of the findings show that different types of food cause GERD. Exercise can cause an increase in acid reflux, and obesity causes acid reflux. Talk about the food that causes acid reflux. The main ones to think about are chocolate, caffeine, alcoholic beverages, citrus-flavored drinks, and different fruits and stuff like that can also cause it. Onions, garlic, vinegar, so you need to stay away from mustards, vinegar, pickles, stuff like that, anything that's been soaked in a vinegar. If you stay away from these foods, there is less occurrences of acid reflux. Activities that cause GERD are the high levels of exercise. So athletes typically have GERD, and so sometimes if it causes so much discomfort, a physician may say maybe you need to cut back on the exercise or the physical activities and see if that helps with the symptoms. Smoking are two of the highest factors when considering what's causing your GERD. So obesity, I have an article that I'll tell you about later. People who are obese or have high BMIs typically have more occurrences of acid reflux. So some of the basic behavioral changes that you can make to treat GERD are smaller portion sizes during meals, don't eat 2 to 3 hours before bed, weight loss, stop smoking if you're a smoker, and then different postures that we're going to talk about for sitting and standing and while sleeping. So I'm going to have a friend demonstrate some of the different postures. Okay, this is Ashley. When you're talking about standing to help with your GERD, you want to always remember to keep your feet at shoulder width apart. Always stand up straight, bring your shoulders back, make sure your neck is aligned with your spine. Relax your arms to the sides of your body. Never lean forward or back when eating. This helps the food to travel down to the stomach in a direct pathway, and there's no kinks in the pathway. When you're sitting, actually we'll go ahead and sit down, you want to make sure that your feet are flat on the ground. This is going to be an issue for women because we like to cross our legs, but remember, do not cross your legs. Relax your hands on your lap at a 45-degree angle that is comfortable. Make sure that your back is aligned with the chair. Don't sit forward and don't sit back. Just place your back firmly against the back of the chair. You also want to make sure that your neck is aligned with your spine. The next position is for while you're sleeping, and you want to always remember to sleep at a 6-inch incline. Your physician can write a prescription for a a cushion to go under you while you're sleeping, or you can use pillows. If you use pillows, you want to find pillows that are very firm and that will not conform to your back, because then you lose some of that 6 inches that you need to be at while you're sleeping. So Ashley is going to lay down in the supine position, which is on her back, and she is going to sleep at a 6-degree angle, or 6-inch angle. The 6-inch angle keeps the from coming back up into the esophagus and the mouth. You'll also find that patients who sleep, or patients when you're sleeping, it is better to sleep on your left side rather than your right side. An article that was published in 2014, Effects of Lateral Positioning in Gastroesophageal Reflux, found that patients that slept on their right side still had a high incidence of reflux while they were sleeping. However, those that slept on their left side, there was a lower occurrence of reflux while sleeping. And then another article that I found that was published in 2014 looked at the body mass index, the exercise, and then the diet in patients with acid reflux. The article found that a higher BMI, and especially male patients, was a good indicator of why they were experiencing acid reflux. So if you are overweight and you are experiencing some of these symptoms, the first line of defense is always going to be to lose weight. That's not always an option, so your physician can provide other recommendations, but that is going to be your first line of defense. All right, thank you.